Hi, I'm Dr. Bardia Anvar from Skilled Wound Care. Today, Henry Okonkwo, our Chief Clinical Officer, and myself are going to discuss the new terminology pressure injury that was put out by the National Pressure Ulcer Advisory Panel. And before I begin, I just would like to say once again that at Skilled Wound Care we work with a lot of nursing facilities that encounter pressure ulcers, and the new terminology pressure injury has come out. And we want to make it really clear to everybody that these injuries or wounds don't occur because of poor care. They most normally occur in patients who have already had medical problems and risk factors that predispose them for the development of these wounds. So the new terminology can be confusing because now we're talking about injuries, such as makes it similar to thinking that these were due to accidents or things like this. And we don't want any of the nursing staff or anyone to feel that way. Henry, what do you think of the new terminology pressure injury, and why do you think the NPUAP went in that direction?
Well, NPUAP switched the definition or the terminology from pressure ulcer to pressure injury, specifically because they wanted to address some of the clinical challenges that were addressed with calling all wounds pressure ulcers. Because when you look at the staging system, you have stage 1s and you have deep tissue injuries that are where the skin is still intact. And so when you're calling that a pressure ulcer stage 1, the skin is still intact, and an ulcer by definition has an association with an open hole. And so there is no break in the skin in those scenarios. And so they clarified the definition by specifically calling it an injury, which is more accurate than calling it an ulcer. So an injury gives a more clear definition or a description of what all types of injuries could be, and then it specifies by each stage exactly what level of injury. If it's one that's only to the skin where the skin is intact, hence you can call it a stage 1 pressure injury, versus a stage 2 pressure ulcer where the skin is broken and it is open, indicating that there is actually a hole in the body.
So basically what you're saying is that an ulcer is with open skin, and when you talk about pressure ulcers that are stage 1, the skin is not open, so they're not technically really ulcers.
Exactly. So the actual wording was completely inaccurate. And so finally NPUAP has made the adjustment to something more accurate by calling it a pressure injury and not a pressure ulcer.
And how do you think this is going to affect nursing facilities in 2016 versus next year in 2017?
Well, the good part is for 2016, no one's going to be affected. Currently, the new definition and guidelines have been recommended and put out there, but they're not fully adopted yet. Not until about 2017 when it actually gets adopted into the coding system. Once it's adopted into the coding system, means that it's going to be part of your actual billing, means that you will bill things as a pressure ulcer and not a pressure injury. So at that time, everyone will have to make the shift. So obviously in the future, you want to start looking for more information from us. We'll try to do a good job of keeping everyone updated as the new terminology and guidelines are fully adopted, and we're all now using pressure injury when we describe wounds versus pressure ulcers.
Gotcha. Any other changes with the stage 1 through 4 classification other than calling them pressure injury that we should know about?
Well, one of the things that they've also sort of helped improve upon is using the Roman numeral system versus the numeric system. Previously, stage 1, 2, 3, and 4, you would write with Roman numerals. So with using the I, and so on, and V's when you're actually trying to stage each one. Now you actually write the number 1, the number 2, the number 3, and the number 4. So that part is really nice because it's made it a lot clearer for people. So there's less chances for making mistakes when you're writing Roman numerals. And also, previously they were using the terminology suspected deep tissue injury. That no longer is going to apply with the new updates. You now will call something a deep tissue injury and not a suspected deep tissue injury. So that part is really nice. They've also added a couple more staging systems, I think.
Yeah, I'm looking at their website right now on the release. This came out in April of 2016.
April 13th.
And I also see that they have something that is called the medical device related pressure injury. And this describes an etiology. Do you have any comments on when we would see that and how we should categorize that?
Well, the good part is you can start using it right away. So that's the nice part. Unfortunately, MDS doesn't have all of those in its guidelines yet, so that'll come in 2017. But you can start using it right away. Medical device-related pressure injuries have been around forever. A lot of times for most patients, they develop pressure ulcers simply from using either a nasal cannula that's wrapped around their ear, which ends up eventually, because the patient lays on the side of their head, they end up developing a pressure ulcer from the actual device laying on, that's been laying across their skin. So it's a great addition to the guideline because it specifically speaks to more accurately, some of the injuries that are occurring to patients due to medical devices.
And I see they've also added mucosal membrane pressure injury. And how would that differ?
By the way, with medical device-related pressure injury, that one will be staged. And this is important because unlike the last one, the mucosal membrane pressure injuries, you do not stage those. So those are specific to injuries that happen at the mucous membrane. Once again, using the nasal cannula as an example, in a medical device-related pressure ulcer, we'd speak about it with the actual hosing causing an injury to the ear. But let's say you have the nasal cannula and the hosing of the cannula in your nose actually causing an ulceration within the mucous membranes of the nose. Now that is now been added to the new guidelines. That will not be staged because it's a mucosal injury, but you can now actually classify it as a specific type of injury to the skin or to the tissue, which can now be documented accurately. So that part is nice.
Very nice. And what is your overall opinion on the new staging guidelines? Do you think this is going to be helpful, hurtful, more confusing?
No. Actually, I think it's fantastic. Over the years, NPUAP has tried to continue to update definitions in the guideline. I mean, just think about it. Before 2007, there was no deep tissue injury and there was no unstageable. So you only had stage 1, 2, 3, and 4 to deal with, which made it extremely difficult when you're trying to actually classify what type of injury you have. And now, as of April 13, 2016, we now have 2 additional classes that you can use to accurately stage your wounds with better improvements on the definition, which helps us be more accurate as we're trying to be clinical with the cases that we're seeing.
Right, very good. And for those nurses out there that are going out and seeing patients in the nursing facility in particular, we do encounter a significant amount of pressure wounds, injuries, formerly known as pressure ulcers. And it's very important to document all of the risk factors, all of the known medical problems of the patient, to kind of describe how much they have contributed to the development of these wounds and how we can prevent these wounds from occurring furthermore in patients, and how we can best heal these wounds. And some patients may not be able to heal, and we need to keep that in mind as well. And really, I would recommend to everyone to review the new guidelines and classifications that were put out by the NPUAP so that you can become more knowledgeable as these become more common in the terminology. And we, of course, are here to support you. And as you may know, that you can click right here and go to our website and sign up for our next wound care certification course, where we will be going over the staging system in depth. And we would look forward to teaching anyone in this system. And also, our team is available to provide rounds in nursing facilities and help elucidate some of the common misconceptions that happens with these wounds. Also, you want to make sure that you rule out vascular disease, diabetic disease, and venous stasis disease in the lower extremity before jumping to classifying your wounds as pressure related. A lot of wounds are related to venous disease. The most common reason patients have lower extremity ulcers, also arterial disease and diabetes are right there behind them. And I see a lot of the times every wound on a patient is always classified as pressure, where they may be related to skin tears or other etiologies. So that's very, very important. So from Skilled Wound Care, I'd like to thank you for joining us. Henry, any final words?
I'm looking forward to seeing everyone out there whenever I get a chance to meet people, and definitely start trying to use the updates and the guidelines, even though that they're not fully adopted yet, because the more you get comfortable with it, the better you'll do at actually clinically assessing your patients.
Okay, thank you very much.
Thank you all. Take care.